Hi, my name is Dr. Anna Saylor with Every Family Chiropractic Center located in Rowlett, Michigan. And today I have Dr. Marissa Heisel with Spines and Minds in Hanover, Ontario. And we're talking about essential oils. We're going to focus on pregnancy and pediatrics today. So thank you for joining us today.
Thank you.
So let's talk a little bit about what we can do, especially with the pregnant mom.
Okay, where would you like to start with that? It's a wide open.
It is a very large subject, we know. Let's kind of focus on, a lot of our pregnant moms come in and, a little bit about pain first, because there's a lot of, what we talk like traditional pain of pregnancy, which as chiropractors, we know that there's nothing traditional about pain, that we can actually help a lot of the symptoms, a lot of things that normally people think are normal for pregnancy, which are not really normal.
Okay.
Let's talk about heartburn, for example.
Okay. So, heartburn in pregnancy is actually fairly common. It doesn't occur with every woman, and yet with some of them it's pretty significant. And so we want to be looking at doing a couple of different things with those moms. We want to be looking at any food sensitivities that they might have, and maybe avoiding certain foods during pregnancy. Sometimes for some women, gluten during pregnancy can be really problematic, or dairy. So we want to be taking a look at something like that. We want to make sure those moms are taking probiotics. So probiotics are good bacteria that we need to make sure are going into our bodies in order to make sure that the health of our gut is as clean as possible.
Okay.
It's also really helpful with warding off any sort of immune compromise, any sort of infection, viral or bacterial. And so making sure that a pregnant woman is taking probiotics can be extremely helpful.
Wonderful.
And then specifically we can look at certain oils that help with digestion.
Okay.
So peppermint topically. Peppermint is one of those oils. There aren't a lot, but there are a few that probably should be stayed away from, at least in first trimester.
Okay.
Chamomile is one of them, and peppermint might be another not to be taken internally, at least in first trimester. After that, the risk really isn't there.
Okay.
But it can be used topically right over the abdomen, right over the digestive valves, as can some specific digestive blends that include a mix of things like caraway and ginger and fennel and peppermint in them. So that can be really helpful in order to decrease the acid reflux that causes some of that heartburn.
Okay. And I know as chiropractors, we actually adjust. We do a very specialized technique called KST, which is corn-specific technique. And we can actually really address the xiphoid process and a lot of the diaphragm issues, a lot of things that will help with the heartburn too.
Absolutely.
So I think the essential oils and the chiropractic go hand in hand. Kind of going back to the ginger, everybody knows ginger for morning sickness.
Yes.
Or, so tell me a little bit what we could do with an essential oil versus a ginger ale, because a lot of people think, if I drink a ginger ale, it might help.
And the amount of ginger that would be found in ginger ale, if any, would be really minimal. Perhaps if you found an all-natural soda in a health food store, there might actually be a little bit of ginger in there.
Actual real ginger.
Actual real ginger, but truthfully, it would probably be pretty minimal. I used to take raw organic ginger and cut off slices and chew on them when I was pregnant, but that's not something that everybody can tolerate.
I usually tell my patients to, slice
Steep
raw
it.
and steam it and actually drink that.
You can do that.
Okay.
Yeah. Sometimes, when I had morning sickness and I was desperate, I would do something else, and you can do that as well. But the nice thing about the essential oils is that there are about 250 drops in a bottle, and a therapeutic dose is 1 or 2 drops. So you can take some ginger and put it into some water. You can take ginger and put it into some hot water and drink that as a cup of ginger tea. And you can certainly steep ginger in hot water as well.
So you're talking about just using a drop of the oil itself.
A drop of the oil.
And it makes a huge difference.
It does.
Okay.
Yeah.
Wonderful.
Yeah.
So let's talk a little bit maybe about pregnancy sciatic pain. Everybody knows about the sciatic pain of pregnancy. What would you suggest essential oils? I mean, as chiropractors, once again, we can adjust for that.
The first thing I would do is make sure that the pelvis is balanced.
Yes.
I would. I'd be looking at the pelvis, and I'd be looking at the pubic bone and make sure that that's balanced.
Okay.
Which will often right there decrease a lot of that inflammatory pain. But if we're looking at something topical, I'd want to be looking at something that's cooling and soothing. Inflammation, of course, is heat, and you don't want to put heat on heat. And so using a peppermint oil, a wintergreen, a soothing blend of oils can also be really helpful. Applied directly over the SI joints, the sciatic joints.
Okay.
You want to be looking
right
at
over the tailbone area.
Right over the tailbone.
Okay.
You want to be looking at whether the glute muscles, the buttocks muscles are balanced as well.
Okay.
And the pubic bone. And you can apply oil over all of those. Pregnancy massage using the essential oils is absolutely incredible and highly beneficial as well.
I know we have 3 wonderful massage therapists in our office that all do a lot of the prenatal pregnancy massages that are fabulous. So what about, is there any other specific oils that you would recommend just for overall pregnancy health?
Well, one of my bigger concerns as a former, I have training in midwifery, and in that profession, one of my biggest concerns as both a chiropractor and a midwife, excuse me, was around stress.
Okay.
You know, there can be an awful lot of stress in a woman's life, and it doesn't necessarily decrease when she's pregnant. It will often increase, in fact. There's financial stress, concern over whether she'll be able to afford to take any sort of maternity leave. There can sometimes be relationship stress that can be fairly profound, and there's a lot of physical stress on a woman's body, isn't there? You know, tremendous changes right from very first trimester.
Yeah, I can say I gained about 50 pounds the first pregnancy, and yeah, lots of stress in my body.
Lots of stress in your body, right? As well as a hormone called relaxin that starts in first trimester and continues right through to third, that causes all of our joints and ligaments to loosen and to stretch, which is helping our bodies get ready for labor and for a growing belly and all of that. But it's really easy to overstress our joints.
Okay.
So I want to be looking at exercise.
Okay.
I want to be looking at that emotional stress as well. And so using some of the oils to help with mood, to help with uplifting or calming or self-love, self-acceptance, those kinds of issues can be really profound in pregnancy.
Yeah. I know, you know, being a mother is probably one of the most stressful jobs, and, you know, preparing for that is very stressful. So basically you're saying an oil will help me kind of just feel better overall, too?
It will.
Okay.
It will. You can diffuse them, certainly,
Wonderful.
in order to help with that overall sense of well-being. You can put them on topically.
Okay.
You know, you can put them on along the spine, would be more for dealing with immune function or for pain. Putting something on your chest perhaps to help with breathing difficulties, because that can become very palpable.
Yes, your ribs change, your whole pelvis changes.
And your diaphragm gets a little bit constricted.
Yes.
Yeah, walking upstairs can become quite a chore that it wasn't before. Okay. But then the emotional aspects of that as well are brought in with things that, with some of the oils that are specifically calming. Okay. And regulating and balancing and grounding.
Because what you feel as a mom, your baby's going to feel.
Yes.
Yes. So
your baby feels, and more importantly, what you feel as a mom is also what happens in terms of the neurotransmitters that your body produces, the hormones that your body is putting out, the chemicals overall in your body. You know, there are an awful lot of things that go on that change not just our chemistry, but then by extension the chemistry of the baby as well.
Which changes the developmental aspects of the baby, right?
If you think about the fact that a baby's brain is hardwiring in utero, we really need to stop and look at that. And so a mother who's under tremendous stress, who's trying to maintain a very, very, you know, busy job, busy practice, or might have a toddler at home, or might have several children at home and is pregnant again, she's not necessarily taking really good care of herself.
Right.
You know, if it's a first-time mom, sometimes you have a little bit more time to really stop and contemplate that pregnancy. But you also have to recognize that the woman's environment might not be really conducive to that. You know, she might not have a lot of external support. And so sometimes taking care of herself is the very last thing that she's doing.
Okay. So is there any very specific oils that you might, right off the top of your head, think like this would be really great for stress relief, especially, and it doesn't have to necessarily be just for a woman, because the whole household could be stressed, right?
True.
Okay.
True. I'd be looking at something that induces feelings of serenity and calm.
Okay.
So oils like ylang ylang or geranium. There's an oil called bergamot, and bergamot is an oil of self-love and self-acceptance.
Okay.
Those would be some of the ones that I'd look at.
Okay.
I'd look at things like all of the citrus oils for uplifting, for changing mood that way.
Okay, and diffusing it in the household would be helpful for everybody.
For everybody.
And then actually using it application, topical on the pregnant moms.
Right.
Wonderful.
Right.
Well, that is awesome.
And a lot of the oils are still going to be safe. In fact, most of them will be safe for ingestion.
Okay.
If they're coming from a very pure source, in order to deal with more therapeutic issues as well. But that would really be on a case-by-case basis and depend on the trimester that she's in as well.
Okay. Does that change trimester to trimester?
Certainly, because there are things in first trimester when that baby is first developing where there are some things that you just wouldn't want to see. Second and third trimester are often more about growth of the fetus as opposed to that really intensive early developmental period.
Okay.
There are some things that we might not want to be using.
Wonderful. I'm Dr. Anna Saylor, and I'm here with Dr. Marissa Heisel, and we're going to take some questions from the audience.
Hi, with the growing popularity of fertility drugs and increasing awareness of their risks and side effects, I was wondering if there are any essential oils that could provide a safer and more natural alternative to some of those medications.
So fertility is one of those tricky issues.
Yes.
You know, there is no one simple direct cause. There are multiple causes to fertility issues. One of the things that concerns me is how much younger and younger women are who are having fertility issues. It really used to be something that we would see in women in their mid-30s and up who were trying to have children, especially a first child at that point. And now we're seeing women in their 20s who are having issues. So we really need to look at multiple causes. We need to look at the environment and what we're spraying on food, what we're ingesting in our food, what some of those chemicals that are being used in chemical processes are doing to our bodies. We need to look at stress and the fact that when there is a lot of stress in our body, progesterone levels decrease and cortisol levels increase. That becomes a little bit of a vicious cycle.
Because you're talking about the flight response, you're talking about all those things going on
and
right
we're
now.
talking about leading a modern life, aren't we?
Yes.
About being very busy, about wearing a lot of different hats, and then trying to get pregnant at a time when perhaps our bodies aren't at their healthiest.
Right. So what can we do as women or even men? Because it's not just it's, they say it's, not 50-50 or 100%. It's, kind of across the board.
It is.
But what can we do to help with fertility?
One thing certainly as a chiropractor that I would say is people can start getting adjusted.
Oh, yes.
To make sure that the nervous systems are functioning as optimally as possible.
And not just one. The man and the woman need to both be adjusted.
Yes. You want to actually see what's going on there in terms of the hormonal health. So certainly seeing a medical doctor for a hormone panel isn't a bad idea. There are an awful lot of things that are called endocrine disruptors or hormone disruptors in our environment.
We're talking plastics.
We're talking plastics. We're talking about things that are called xenoestrogens. They're known as the false estrogens. They're kind of the big bad monsters of estrogen, and they compete in our bodies for our natural estrogen. And we need to remember that both men and women have estrogen in their bodies. This isn't just something that women have, and we really want to be looking at what we're being exposed to that could potentially be doing something to our hormonal balance.
And it's balance. It's all about balance.
It is a balance with something like hormones. And in fact, with women, we know that hormones fluctuate constantly. That's what they're supposed to do. It's when they're not fluctuating or the right ones aren't necessarily coming up at the time that they can be that we start to run into some issues.
So what can we do?
There are different things that we can do. We want to be looking at things like exercise, which will help with balancing some of those hormones in our bodies. We want to be looking at certain oils that can be really helpful. Things like clary sage and clove, ylang ylang, and different blends that are specifically formulated for different times of the month in women's health. And we really, really need to be addressing the stress that we're under. We can't necessarily leave our work or change our financial situation, but we need to find ways to really start to address that mindfulness piece of hormonal health.
So a little more about stress management too.
Stress management, meditation, being present in our bodies, exercise, things that will help increase some of those uplifting mood hormones and decrease some of those stress hormones.
So balance seems to be a really good one for that too, a grounding.
Yes.
What about for the men? The fertility with the men. Is there anything specific that you could think of that would help with a man?
Again, the first thing that I would want to look at would be the presence of whether there are any xenoestrogens that are throwing off the testosterone balance in men. And so looking at a blend that increases phytoestrogens, or that provides phytoestrogens, which are plant-based estrogens, they will help the body to get back online with our natural estrogens and will actually compete with those xenoestrogens. And so that's a little bit of a dance that we need to go through in our bodies, but we want to start looking at some of those issues as well.
Let's talk a little bit about the post-pregnancy aspect. What can women do? I know there's a lot of issues with breastfeeding or lactation, mastitis, right after the baby's born. What can we do?
That's a really tricky period to first initiate breastfeeding if women want to, isn't it?
Yes.
It can be. It's never quite as simple as women think it's going to be. So one thing that we want to look at is really making sure that we can initiate breastfeeding and initiate milk production. So one thing that's very helpful with that is clary sage. And some of the oils that are useful at helping to maintain that would be basil or fennel, which can all be taken internally. They can also be applied topically. And you can do that in a sort of a self-massage fashion. Something that can happen for some women is mastitis, and that's where you get a bit of a blocked milk duct. And what you'd want to do then is to actually topically apply a mixture of lavender and some of the citrus oils mixed with a carrier oil, something like coconut oil, which we've talked about once or twice, and apply that topically as well in a massage-like fashion in order to work through some of those clogged ducts. Otherwise, the medical treatment for that would be antibiotics. And what ends up happening is that the baby is exposed to the antibiotics as they go through the woman's breast milk just as much as the mother is exposed to them. And it'll immediately cause in the child and this newborn infant a real issue with gut health, with wiping out any of the good bacteria that's starting to be produced in their gut. And you can end up with a child who's exposed to multiple infections after that. So we really want to try to find ways to steer clear of antibiotics and find something else that we can use if mom has or is experiencing mastitis.
Okay, so the key to that is actually prevention with mastitis, right?
Right.
Okay. One of the things that we always recommend is you can actually soak like even a pad with the different oils, put it in a freezer, and use that as a cooling sensation too, which seems to really calm everything down. So that is
You can.
Okay.
You just want to watch for something like ice over the breast tissue. That wouldn't necessarily be the first thing, but you also want to make sure that you're not using something that's too hot. So more like a soothing compress.
Okay.
But you're absolutely right. You can soak those with some of the oils directly.
Okay.
It's a really nice way to think about doing something like that.
A lot of people know they can take things like you'll say with milk production, like blessed thistle and milk thistle.
Fenugreek.
Yes.
Yeah.
How would that compare to? Would you use it in conjunction with an essential oil?
You certainly can. You know, with fenugreek and blessed thistle, in order to maintain milk production, they normally need to be taken for an extended period of time.
Okay.
It's rare that you see somebody who only needs it for a couple of days. It's normally something that needs to be continued for a couple of months. Whereas with the essential oils, they'll often make sure that milk production sort of kicks into high gear and continues.
Okay.
You're also talking about a drop or two. So you could always take a drop or two in a little bit of water if you needed it for an extended period of time.
Okay.
The difference is that the essential oils are about 50 to 70 times more potent than their herbal counterparts.
Okay, so much more potent.
Much more potent.
More effective too. Okay, wonderful.
And faster acting generally.
Okay, so let's talk a little bit about what we can do for the newborn baby. So, you know, hopefully everybody's blessed with an amazing, healthy, wonderful baby that sleeps through the night, and you know, it's just awesome. And we know that we see a lot of that because we're both chiropractors. We do see a lot of wonderful, healthy babies, but sometimes you have some issues. You know, let's talk about colic.
So colic is usually a digestive issue,
Okay.
and it's often related, in fact, at least in a breastfed child, it's related sometimes to what the mother's eating.
Right.
So we'd want to take a look at whether she's eating a lot of gas-producing foods, cruciferous vegetables, broccoli, cabbage, those kinds of things.
Onions too seem to be a
Onions.
really bad.
Yeah. If mom eats a lot of soy, there are some babies that don't tolerate soy well. There are a lot of babies who do not tolerate dairy well. And so if mom drinks a lot of milk or takes in a lot of cheese or really loves ice cream, those might be things that can cause an awful lot of gastric upset, of stomach upset in a young child. So you'd want to look at that.
Okay.
You'd also then want to look at if a child is being formula fed, what's in the formula. Because I've seen an awful lot of kids in my practice, at least, who are on a specific formula that'll be dairy based and they're just not tolerating it well.
Right.
And sometimes it can be as simple as changing the formula, sometimes to one that is non-dairy based, sometimes to one that doesn't have iron, because there are certainly kids who don't do really well with iron in formula.
And there's a lot of iron fortifieds.
There are an awful lot of iron fortified formulas, and they don't always do well in the early neonatal period with iron formula. And so switching formula can be very beneficial. Kids who are formula fed really need probiotics.
Okay.
You know, and you can get infant probiotics that are powdered, that can be put right into a bottle, or that can even just be popped right into a baby's mouth. You're talking about a quarter teaspoon.
Okay.
And they'll just sort of, lick it off their lips. And that's really, really helpful for establishing good gut health from the very beginning of a child's life.
Okay, and what about an essential oil? What can we do to help with that?
What you'd want to make sure is that you're using a carrier oil, but you can apply the oils directly over a baby's tummy.
Okay.
So something like peppermint or a digestive blend that's a mix of oils with things like peppermint and fennel and ginger, and different companies will produce something like that.
And by a carrier oil, you're meaning like a coconut oil?
Like a coconut oil, or an almond oil or a wheat germ oil, something that's an all natural oil that you can mix the essential oil with and then rub into baby's tummy.
Not a baby oil.
Not a baby oil. Baby oil contains too many chemicals and is petroleum based, and you just don't want that getting into a newborn system. It gets right into their bloodstream if you apply it topically, even to their skin.
Okay. So we don't want to do that.
We don't want to do that.
And the soles of the feet with babies, that seems to be the key for like the magic area.
It's an amazing root. Yeah,
okay.
It's an amazing root. The skin is the largest organ in the body, and the feet are the most porous skin in the body. And anything that we apply topically to the feet is going to get into the bloodstream to affect changes really, really rapidly, within about 20 seconds, in fact.
Wonderful. So let's talk about diaper rash.
Okay.
Okay. I know a lot of times, and they say it's, not, it's not a coincidence, or it is a coincidence. Whenever my daughter would teeth, she would get a diaper rash.
Mm-hmm.
It was just, and this is before I knew a lot of what I do know. What would you do in those cases?
Your point about teething is an interesting one, because my oldest is 11 years old, and when he was teething, there was still a belief system in the medical profession that children don't get fevers when they're teething, children don't get diaper rashes when they're teething, and every mom knew that wasn't the case.
That is not true.
It was
flaming
not
red
true.
head,
And
flaming red butt.
Every mom knew this. And it took a while. The medical professionals will now say, yes, they'll get a mild fever, and yes, they can get a rash. And so I'm glad to see that that's changed. But, the wisdom of mothers has always existed.
Yes.
What we can do certainly is use a really gentle, calming oil for skin.
Okay.
So something like lavender. And lavender is the least caustic, the least irritating oil on the skin. So even for an infant, it would likely be fine to apply lavender directly. But if you've got a really sore red bottom, potentially with open sores, you wouldn't want to be doing that. You'd again want to be mixing a couple of drops. Again, therapeutically, you're only talking a couple of drops, because these oils are so potent, into a little bit of a carrier oil, a coconut oil, something that's very, very gentle on the skin, especially if you're talking about a rash or open sores, and then working that in.
And would you do it on every diaper change? Would you do it on a daily basis?
I would certainly do it on every diaper change.
Every diaper change?
Yeah,
Okay.
especially when it's really irritable. If the baby's skin is intact and doesn't look irritated, if they're clearly not in pain, there's no need to do it on a regular basis. Really just a little bit of water is the best way to go, not even using any of the commercially prepared baby wipes. But using a really, really soft washcloth with nothing but water is the best way to clean off their skin. As soon as you see something that's irritable or clearly painful for them, you want to start looking at some form of treatment, because some of those sores can get infected otherwise.
They just get worse.
And they can get worse.
Okay. So let's talk a little bit about constipation.
Okay.
So as chiropractors, there's a lot we can do with constipation. It's, we find, and I know you probably find it in your practice too, that if the nervous system's not functioning as well, kids are going to tend to be constipated.
Absolutely.
But then we're talking about the gut. We're talking about a lot of different other systems. So tell me a little bit more what we could do with an essential oil to help with constipation.
We'd want to be looking at something, again, that we can apply topically. And there are a couple of different things that we can use in order to help maintain digestive health.
Okay.
Peppermint is one of them. Ginger would be another. Even lavender. We don't traditionally think of lavender for abdominal issues, but in a baby who's really young, it can be very, very helpful to rub a little bit of lavender right into the tummy. And you can start to experiment with mixing a couple of the different essential oils. Again, only 1 or 2 drops at most, and using a carrier oil and rubbing that right into the baby's belly. And when we're talking about putting something on a baby, there's nothing better for them than doing a little bit of touch and massage.
Wonderful.
You don't have to be a professional in order to apply some oils to your hands with some sort of a carrier oil and really work,
And it's done with love.
And it's done with love,
And
always.
That's actually what's most important.
And it's
So-
incredibly therapeutic, that sense of touch, and it's bonding.
Okay. Well, once again, I want to thank you so much for joining us.
Thank you.
I'm sitting here with Dr. Marissa Heisel from Spines and Minds in Hanover, Ontario, and I'm Dr. Anna Saylor with Van Every Family Chiropractic Center, located in Royal Oak, Michigan. And we just had a wonderful discussion about using essential oils for pregnancy and pediatrics. So thank you for joining us, and we'll see you soon.